my name's Rebecca. I'm going to be your nurse today.
Okay.
I'm going to be doing a head-to-toe exam on you. Could you tell me your name and your birthday?
Teresa Tillery, 9/16/56.
All right. Could you tell me what day of the week it is?
It's Tuesday,
And could you tell me about what time of day it is?
7:30 in the evening
And do you know where you are?
in my house.
All right. I have an alert and oriented 64-year-old. We predetermined vital signs. Her respiratory rate was 16. Her heart rate was 78. Her blood pressure was 120/80. Her height is 5'5". Her weight is 180. And her BMI is 30. I'm going to go ahead and start with this head-to-toe exam, starting with the scalp. And looking at the scalp, it is pink intact. There are no signs of lesions. The hair is smooth. There's no sign of infestations. And then the head is also normocephalic with no signs of acromegaly or hydrocephalus. Looking down to the face, the ears are symmetrical. They are not low set. They are of normal growth. There is no visible drainage in either ear. There is no tenderness. Both ears are pierced bilaterally. Looking at the eyes, the eyebrows are symmetrical. The hair is of even distribution. The eyes are symmetrical to the face. The eyelids open and close with ease. No signs of ptosis. And then looking at the eyes, the conjunctiva are clear and vascular. The sclera is white and clear. And if you could go ahead and look straight ahead of me, shining a light. Pupils are equal, round, and reactive, and this tests cranial nerve 3. I'm also going to test cranial nerve 2, which is the optic nerve. If you could read the lowest line for me.
DEFPOTEC.
All right, and cranial nerve 2, the optic nerve, is intact. And then I will also test cranial nerves 3, 4, and 6, which are trochlear, oculomotor, and abductus. If you could follow the pen with your eyes and not with your head. And judging this with the fields of gaze, all of these cranial nerves are intact. Looking at the nose, it is symmetrical midline. And then looking at the nares, they are pink, moist, intact, and there is no sign of deviation of the septum. And then if you could go ahead and close your eyes for me, I'm going to test the cranial nerve 1. If you could tell me what you smell.
Cinnamon.
And again.
Cinnamon.
All right, cranial nerve 1 is intact. I'm also going to go ahead now and palpate the frontal and maxillary sinuses, and there are no tenderness noted. Looking at the lips, they are pink, moist, and intact. If you could open your mouth for me. All right, looking in the mouth, the tongue and base of the mouth are pink, moist, intact. The teeth are white and intact with no visible caries. If you could say ah for me.
Ah.
All right. Saying ah is testing the vagus nerve, which is cranial nerve 10, and there's equal rise and fall of the palate and the uvula. If you could stick your tongue out for me and move it side to side. All right, that is testing cranial nerve 12, which is hypoglossal, and that nerve is intact. And then to test the hypopharyngeal, which is cranial nerve 9. Do you have any problems swallowing or with gagging?
No.
All right, then that cranial nerve is intact. I'm going to go ahead and palpate the lymph nodes, which will be the pre and post auricular, the occipital, and then the submandibular, the mantle, the pre and post cervical, and the subclavicular. All lymph nodes are non-palpable and no masses are found. I'm also going to palpate the thyroid. If you could scoot that way for me. Palpating the thyroid, there are no nodules found, no masses. Could you swallow for me? And no deviations. Looking at the throat, there are no deviations in the throat or the trachea. I'm going to go ahead and test a sensor, the trigeminal nerve, which is 5. If you could close your eyes for me and just tell me if you if you feel soft or sharp.
Soft. Sharp. Soft. Soft. Sharp. Soft.
All right, and that nerve is intact. All right, I'm moving on. I'm going to go ahead and assess the cardiovascular system. So we'll begin by 1, feeling the carotid pulses, which are +2 bilaterally, and then listening to it with the bell of the stethoscope. If you could hold your breath. And no bruits are heard. And then I will go down and assess the pulses, starting with the aortic, which is the second intercostal space right of the sternal border, the pulmonary, which is the second intercostal space left of the sternal border, Erb's point, which is the third intercostal space left of the sternal border. If you could lift your shirt up for me. The tricuspid, which is the fourth intercostal space left of the sternal border, and the mitral, which is the fifth intercostal space left of the sternal border, midclavicular. And normally you would have them lay on their left side so you could hear the maximal impulse. In observing the chest, there is no visible heaves, lifts, or thrills at the PMI. The heart sounds were S1 and S2 with no gallops, murmurs, or extra sounds heard. And then assessing with the arms, the muscle mass is even in normotonic tone. The radial pulses are +2 bilaterally. The pedal pulses are +2 bilaterally as well. And then going into the respiratory, you would start listening for a full breath cycle in all of the lobes, but you would start anteriorly at the apexes and at the bases. All right, and if you could turn that way for me.
Okay.
And we will lift up the shirt and you will start listening at the apex of the lungs, moving down to each lobe and into the bases of the lung, including the right middle lobe. All lung sounds are clear and equal with no adventitious sounds. The anterior posterior diameter is 1/2 the transverse, indicating no barrel chest. I'm also going to palpate the back for tenderness, and there is no CVA tenderness noted. All right, and if you could lay on your back for me. And we'll lift up your shirt. And we will continue looking at the abdomen. There is no noticeable, again, heaves, lifts, or thrills in the PMI. The aortic region has no abnormal pulsations. And then auscultating with the bell of the stethoscope, there are no bruits heard. Moving down, you would assess the femoral pulses, which are +2 bilaterally. And then looking at the abdomen, the skin is the appropriate color for ethnicity, equal distribution, no scars, tattoos, no piercings. The abdomen is round. You would start by auscultating the upper or the lower right quadrant. And you would listen to each quadrant for 30 seconds and then go to the upper right, the upper left, and then the lower left quadrant. All bowel sounds are heard, and there's no bruits heard. And then you would go to percuss all 4 quadrants. There is tympany over all 4 quadrants and a dullness over all of the organs. If you could take a deep breath in for me, palpating the liver. There are no masses or abnormalities found in the liver, and then palpating the bladder. It is not distended. There is no tenderness, and there's no abnormalities found. Continuing on with palpation of the abdomen, you do light, medium to deep palpation in all 4 quadrants, assessing for tenderness. There is no tenderness, masses, or abnormalities found. All right, then go ahead and have you sit up.
Okay.
Okay, and if you could squeeze my fingers for me. All right, grip reflexes are 5 out of 5. And then if you could push on my hands, thank you. And foot pushes are also 5 out of 5. I'm going to also test the cerebellar function. So if you were to put your hands right here and then just flip them over like that. All right, that's part of the cerebellum function is intact. I'm also going to do another sensory test. If you could close your eyes for me and tell me if it is sharp or soft.
Sharp. Soft. Sharp. Soft.
All right, and the sensory function is intact. I would also then assess for deep tendon reflexes. You would assess them on the biceps, the triceps, the brachioradialis. You would test this bilaterally. I would also test the patellar and the Achilles for tendon reflexes. And then if you could stand up for me.
Okay.
All right, I'm going to test the Romberg test. So if you could close your eyes and stand on one foot. All right, and there's no swaying. If you could keep your eyes closed, stick your hands out in front of you, and then flip them over. All right, and there's no prodromal drift. All right, you can open your eyes. If you can take a couple steps for me, heel to toe, and then do that backwards for me. All right, there is normal gait and tandem with the patient. And you can go ahead and sit back down.
Okay.